JR. Once again substituting, here's Kevin Dietz.
As health professionals put out warnings of a possible second wave of COVID-19, there is a new national poll that says 1 in 3 parents plan to skip flu shots this year. 1 in 3 parents planning to skip flu shots this year. What impact will that have? Joining us now is Dr. Robert Klever, Emergency Department Physician at DMC. Doctor, thanks for being on the Paul W. Smith Show.
Hey, thanks for having me, Kevin.
So, yeah, we were talking a little bit about the flu shot, and, typically people go get them so they don't get the flu. Sometimes people are afraid of getting a flu shot thinking it will give them the flu. But this year, it's really a different kind of a year because some people I talk to, they will tell me that they don't think the flu is going to be a problem this year because they're wearing masks, they're social distancing, they're washing their hands all the time, and they don't think they're going to get the flu, so they don't feel like they need a flu shot. On the other hand, some people I talk to say, I haven't been out and about much, so I haven't been in much contact, so I'm not sure if I've built up any natural resistance to getting sick this year, and maybe this year I need a flu shot more than any other year. What are you seeing as far as flu shots go, and what are you recommending?
Well, I kind of answer those are both a little bit two separate things. One is that the flu and COVID-19 are two separate disease processes. I guess the similar, if you say you don't need one, you don't need the other. That's analogous to saying I don't need to wear my seatbelt because I have airbags in my car. As far as the flu vaccine going, we have, especially early on when it was still flu season in March and April, we had a fair amount of co-infections, and unfortunately those people were very, very ill, which I think led to the increased mortality rate in the beginning. But as far as the flu vaccine, we're just getting around. I got mine about 2 weeks ago. And, I do understand to a degree people not wanting to get it. Nobody really wants a needle, but when you just look at the science and the data and the numbers, what we most want is people to be safe. And therefore, we advocate for everybody above the age of 6 months who does not have any contraindications of the flu vaccine to get a flu vaccine.
And as far as people having concerns about going out to get a flu shot, they're really not at any more risk of catching COVID than going to the grocery store or somewhere else, as long as they follow their protocols. And I'm not trying to mix COVID with the flu shot here, but I think that some people just don't want to go out unless they have to. And the question is, do you have to get a flu shot or not?
What I would say to that is that I agree with you that I don't think going out to get a flu shot is any more or less safe than doing anything else. Actually, I would say it's a little bit more safe knowing that, when people come into the hospital, we have screening places to check your temperature. If you don't have a mask will be provided, and they give you hand sanitizer, which I don't think are all provided at all the grocery stores and the other places. So I would say going to the hospital at some degree is a little bit safer than going to the grocery store. So I would recommend that people go out. I do believe that I hope that we'll have a milder flu season because of the masks and the social distancing and the people using the hand sanitizer. But make no bones about it, the flu is still very dangerous. Still, a lot of people die from the flu. We want to prevent people from having the flu, period, and then especially more so in the year 2020, 2021.
Does the weather play a role in how bad the flu season is, or is it simply what strain gets out and how quickly it's passed around?
I don't think the weather plays as much of a role as people think it does. What ends up happening during the wintertime is we're just in a little bit closer quarters where, you may, take the dog out for a long walk. You don't do that as much, and the other things that you would spend some time going outside, watching your kids' sports games, walking the beach, all those things happen a little bit less, and our personal interactions happen a little bit more with the holidays and everything else.
And when people ask you how likely is a flu shot to keep me from catching the flu, do we know any actual numbers, how well they actually work?
That's a pretty difficult question to answer. The flu shot is pretty effective, and they have different types of strains of the flu. And the most common flu is the H1n1 flu that people have heard about. And the year of the H1n1, the flu vaccine wasn't too effective against preventing you from getting that. What the flu vaccine was very, very much effective at is if you catch that H1n1 or any of the other types of flus, H3N2, it prevents you from being as sick, it prevents you from being as sick as long, and it prevents your viral shedding or the degree that you can transmit the virus to somebody else. So for all those reasons, all those positive reasons, with the added benefit that we think that it probably can prevent the flu too, even if they miss it, and instead of being H1N1, maybe it's H1N2, it'll help prevent that too. We recommend getting the flu vaccine, and that's why since 2008 I've been getting the flu vaccine every year.
That's awesome. Okay. And in addition to getting the flu shot, what else can people do to help themselves from not catching the flu or from not getting sick?
Well, I think people just need to be diligent in, wearing their masks and their hand sanitizers and social distancing. Those things, the flu is a respiratory airborne virus as well, and all that helps prevent that. And we're hoping that we'll see what they saw in Australia. For those that don't know, Australia, they're just going from their winter into their spring, so the opposite of us. That their flu season was relatively mild compared to previous years. And we as healthcare providers and, stewards of patient health, we really do hope that we have something similar. So all the things that help with the transmission of COVID, we're hoping will help with the flu as well. And we really, really don't want to see these co-infections because unfortunately those patients are going to be becoming pretty sick with both the flu and COVID.
All right, so go out and get your flu shot. Dr. Robert Klever from DMC, thanks for being on the Paul W. Smith Show this morning.